The Boston Congress of Public Health is already making great strides in socializing and democratizing public health and social justice issues just by introducing these concepts to young adults, thereby equipping and empowering future health and social justice practitioners. I hope that the Boston College of Public Health continues to move into spaces and places that have gaps and reach all people via different communication formats, thereby socializing further and democratizing public health and social justice.
BCPH is
Thanks.
dedicated to making changes, to creating changes within public health and social justice through various initiatives. And they are currently working closely with public health researchers and policymakers to develop evidence-based strategies that promote health equity and social justice. The organization is also currently active in engaging advocacy efforts, raising awareness about key public health issues, and pressing for policy reforms. Through partnerships and with communities and organizations, BCPH implements programs and interventions that address health disparities and promotes equitable access to healthcare. By fostering collaboration, research, and action, BCPH also strives to make a meaningful impact in public health and social justice at local, national, and the global levels.
I think BCPH is doing a great job in that they are beaming lights on many issues as regards public health that are not mainstreamed, and they are like harbingers, like a nexus bringing together different areas of public health and social justice, that space where people like myself who necessarily are not in the same space could come together in that same space, you know, bring out their thoughts and drive those thoughts to the audiences, and most importantly to those who are in positions to make change in areas of social justice, just like I talked about the laws and the politics and policy engagements and implementation. So I think BCPH is doing a great job when it comes to beaming that light on issues that need to be talked about, especially in this age.
Boston Congress of Public Health is making changes in the area of public health and social justice by really taking an open and welcoming approach to training people, to spreading knowledge, to building professional relationships, building community around issues of health and justice. I look at the programming that they're doing, and I'm really inspired about what else is possible, right? I think it's showing a good model that can be replicated perhaps in city health departments, in universities. The emphasis on opening up the knowledge and process of public health to more people and creating more entry points and touch points is something that needs to happen not just in organizations like BCPH, but also in universities, in government offices. And I think it's a really great model of what are the kinds of conversations that are possible when you do that, what are the kinds of connections you can make when you do that. So I think I look at BCPH as sort of a sign of a more accessible future for public health that we really need in an era of misinformation, mistrust, disinformation, distrust, and really finding ways of being present in more spaces, bringing public health into areas where it might not already be, as like a field, as a conversation, as a community, and really emphasizing that these conversations should be happening everywhere. And for example, in my background as a researcher, I look to BCPH as a model of how to build more communities of practice and how to invite more people into the spaces I might be in the future.
What attracted you to the Boston Congress?
I think that there is a group of very innovative new generation researchers that are taking a lot of issues in a very academic way, but also in a way that they want to disseminate their knowledge and their experience